Hello, my name is Dr. Vuisil Nkomo, and I'm the Director of the Valve Clinic at the Mayo Clinic, Rochester. The name of the article we'll be talking about briefly today is Management of Patients with Aortic Valve Stenosis, and the article will appear in the April 2018 issue of the Mayo Clinic Proceedings. The main takeaway message of this article is that there has been dramatic change in the assessment and management of patients with aortic valve stenosis. The article is a review of the current status, emerging knowledge, and the current guidelines related to the detection, assessment, and treatment of aortic valve stenosis. The review includes discussing the different types and categories of aortic valve stenosis, as well as their diversity and complexity in patient presentation, and the advent of transcatheter aortic valve therapies, that is TAVR, that have really revolutionized the way aortic valve stenosis is treated. Mayo Clinic provides the most comprehensive assessment and management of patients with aortic valve stenosis and related conditions. In the long tradition of the Mayo Clinic, we have always had a heart team approach to evaluating and treating all forms of valve diseases. The recent guidelines on the management of patients with valve disease emphasize a heart team approach when caring for patients with valve diseases. And this heart team approach has been the standard at the Mayo Clinic going back decades. Mayo Clinic participated in all the important earlier clinical trials examining the use of TAVR versus open heart surgery in treating aortic valve stenosis in patients that were high or intermediate surgical risk and those that were inoperable. The results of those trials have dramatically changed how we treat aortic valve stenosis, as discussed in the review article published in the Mayo Clinic Proceedings. Mayo Clinic is also participating in ongoing clinical trials that are examining TAVR versus open heart surgery to treat aortic valve stenosis in low-risk patients, as well as patients that have moderate degree of aortic valve stenosis, but in the setting of heart failure. The goal there is to see if relieving the aortic valve stenosis improves the underlying heart failure and patient symptoms and overall life expectancy. In addition to that, Mayo Clinic is participating in a clinical trial examining TAVR versus continued surveillance in patients who have severe aortic valve stenosis but are completely asymptomatic and have normal heart function. The goal there is to see if very early intervention is better than watchful waiting until the patient develops symptoms or heart failure before offering aortic valve replacement. Clinical practice has already changed in terms of assessment and management of aortic valve stenosis. Accumulating data and knowledge from ongoing research, such as the kind I just mentioned, will only mean continued changes, and we hope we're able to disseminate all that information in a timely manner to our readers. Patients will now have more options in terms of available treatments for aortic valve stenosis, and the timing of aortic valve replacement may be proved to be more effective if performed earlier than what is currently recommended. We will obviously have to wait for the results of the clinical trials. In the meantime, I think there needs to be greater effort in raising patient awareness, as well as awareness in the medical community about valvular heart diseases in general and aortic valve stenosis in particular, because of the silent yet fatal nature of these disorders. In other words, we need to work harder at recognizing early signs and symptoms of valve disease. We need to take murmurs seriously because they could be the only indication that something is seriously wrong with the heart valves. And patients as well as family members need to ask whether underlying valve disease may be the cause of otherwise nonspecific symptoms such as fatigue or slowing down, instead of blaming it on getting older. Valve diseases are more common as we get older, and there's a tendency to blame aging when we're not feeling well, and we miss very important, crucial opportunities to offer life-saving therapies. Unfortunately, we continue to encounter patients whose aortic valve stenosis and heart failure are too advanced, and others who have too many competing illnesses for aortic valve replacement to be an option. We hope early detection of valve disease and the availability now of less invasive curative therapies will mean more valve diseases will be treated. Thank you for your interest in our article. We hope you enjoy reading it.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.